In conclusion, we just have recently received the data, so the study timeline is to analyze this data, and I will be happy to let you know as those things progress. It is the PI's intention to submit our findings for publication this summer. So again, I'd be happy to keep you updated as we crunch the numbers. But really, the effects of religion and spirituality on health are striking. I think that as we survey these studies and think about these effects, it's really something that's important. Hearkening back to, did patients actually end up talking about this with their doctors? That number was really low, and I bring back up this disconnect. Why is there that disconnect? Well, certainly it's a cultural thing as a result of proselytizing and just a culture that sort of doesn't want to talk about this. We would rather not, and so I think that's certainly an effect. And I sort of have a story in that regard. This fall at the symposium I put on, one of the physicians was there, and I said, "Okay, doc, you've heard all the evidence, and this is clearly something that has a profound effect. Are you going to ask your patients about their spirituality or religion and, do whatever you can to foster that?" He said, "Geez, Blake, I don't know. That's really personal." I said, "Doc, you give these patients rectal exams. Aren't we already in the personal? Can't we perhaps create criteria to address this professionally? And if we've already created criteria to, do breast exams and rectal exams, can't we find a way to tackle this sensitive issue too?" So really, not only are the effects striking, but the disconnect is striking, and we maybe need to think about addressing that disconnect as we go forward. In sort of thinking about what do we do with this information? What does this mean for people and their medical care? Well, I think about the developing world. I think about places like Latin America, where, especially in rural Latin America, where access to complex or even sometimes basic medical care is just not there, and it's just not in the cards to have bypass surgery offered in many of these rural places of the world and the developing world. So, but what's not rare is these religious and spiritual institutions. If we can partner with the Catholic Church in many of these rural areas, or the shamans, the witch doctors, perhaps we can really increase the health and wellness of many people in the developing world by using existing institutions cooperatively rather than antagonistically. Since we've talked about religion today, I suppose it's only right we bring up politics. We've talked about in this country very recently what to do about our healthcare system. We spend more in this country than anyone else, yet we have worse outcomes. So if a chaplain visit can be shown to have as good of effect or better of an effect than Tylenol, and it's cheaper than Tylenol, I hate to bring it down to dollars and cents, but perhaps faith in medicine is in fact a very economical way to deliver patient care. Perhaps economics would really drive some of these integration methods. And these were back-of-the-envelope calculations with how much Tylenol a chaplain visit would cost. Chaplain visits are, in fact, free. You just request them, and those services are given. But really what this all comes down to, in my opinion, is making a holistic patient care model, giving patients a medical home in which they are treated in multiple dimensions, mind, body, and spirit. And I think that that's really what this comes down to. How can we give patients the most holistic medical care that we can possibly provide to not only encourage their wellness, but hopefully ameliorate or reduce the disease. And with that, I would like to take your questions.